All right, so today we're going to talk about the upper extremity muscles. They're all out here. Have a good day. Go home, study them. These first slides are just general muscle slides. They're pretty good as baseline of what the muscles look like. And then third slide here, we get sort of into the beginning points of what we're going to talk about. We're going to go through muscles. The way I do the muscles of the upper extremity, I do them by what muscles move what areas of the body. So I'm going to have some that move the shoulder, or actually some that anchor the shoulder into the trunk. So if you think about this Johnny here, this skeleton here, you have the shoulder blade, and you need to put that shoulder blade somehow into the trunk. And then from that point on, you can attach that extremity, that upper extremity. But if you don't have anchors here, that's not going to work. I find a lot of people, they don't have anchors because the muscles here look like this, they're the same muscles like on a horse. But a horse is a four-legged thing. And now these things that were pushed up by gravity, and we have to hold the shoulder blade in this way, now all of a sudden they're just hanging down. That's a very different mechanics. So we have issues with that. The shoulder is very interesting. The shoulder is very flexible, but it's very delicate. Right?
I know this is a weird question. Watching the one with Mel Gibson and Danny Glover, you know how he always had that problem with his arm? And
you yanked it into the
yeah.
wall?
What was that?
Well, don't do it.
I mean, I'm not going to do it, but
that is, his shoulder here is not right.
Right.
It's forward, and it fell out.
Oh.
And he just goes in and he yanks it against the wall here, then he brings it back in. But it's, I don't know.
That's TV, huh?
It's probably not even, it's probably Mel Gibson.
Oh, you're right.
So once that is anchored, then we can attach everything. So we've got muscles that hold that humerus into that shoulder blade. That's the rotator cuff. You heard of rotator cuffs?
Mine's just torn.
There you go. That's what that's doing. So we got a set of also doing that. And then of course we've got to move this sucker around. That's pretty intense. That's a lot of movement here.
I can't do all that.
And then, it's okay. No, you're not plastic. And then we got the elbow joint. The elbow joint does some motions. We got the forearm muscles that do the forearm joints do this motion. We also got flexion and extension here. And then we got finger stuff. Fingers do this motion, then the thumb does the opposite. So we got multiple places where we need to put muscles to that can do those motions. Remember, muscles just motion. That's what they do. They contract. So that's the overview picture. That's another overview picture. So let's first start going into the shoulder anchors. So they attach the scapula to the axial skeleton. That's a trunk. The first one of my favorites, is my boss's anatomy muscle. We often think of that the trapezius. The trapezius does that. However, this muscle here, the levator scapula muscle, attaches on the shoulder blade, on the scapula, the medial top side, and goes into the top of the spine, of the cervical spine. So it enters from the shoulder blade here, the tip, we have right here, the superior angle, and it's a thick muscle. It's really nice and big. And it goes and pulls it up into the top of the neck and anchors that shoulder blade in that top and down, up, superior, inferior direction. So if you walk around like that, your boss is mad at you because he just wants to hit you. That muscle, well, hopefully not, but that muscle, of course, tightens up. It's a very big muscle.
That can tense up really, and when you're doing it like that, right?
That muscle is very tense on a lot of people. And then it pulls on the neck, and then it pulls here, and that gives you neck pain, or it can give you neck pain. So that's the attachment. I look at the transverse process on the C1 to C4. That's up here, the origin, because that actually pulls the shoulder blade up. Levator, scapula. You look at the neck, elevating the scapula. And that's the medial border of the scapula and superior angle. And then it elevates the scapula. And it also, what else it does is, when it pulls here, it pulls that shoulder blade down a little bit, the way it pulls. If it pulls up here, the shoulder blade rotates slightly. So it goes like that, a little bit. And so that's what it says here. It rotates the glenoid cavity down. That's the glenoid cavity here. So when you do this, you can have that muscle do some of that, help that motion. Does that make sense? Yeah, that's why, this is why these muscles, you can massage them here. Oh, by the way, I didn't point that out. These pictures here that I always have on every muscle with the dots and the X's, that's Janet Travell. Janet Travell was John F. Kennedy's doctor. And she is heavily into these things called trigger points. So she mapped. And a lot of people map, but she's really the one that pulled all that data together and made nice big books out of it. And she mapped that pain patterns distributed around here are caused by trigger points, by bands that are really tight muscle bands in these areas where the X's are. So you can take these handouts and just sort of play with, your friends and family and say, like, you got shoulder pain? Okay, let's poke this one and see. But you're going to find a nodule here. Then you know this levator scapula has got a problem. And you can help it by squeezing that nodule or massaging it out, and that decreases that pain.
So what is that nodule? Because I've felt those before on various
But that nodule, well, that's a good question. She describes it in the book that there is, when you look at muscle fibers, you have some muscle fibers that have a spindle around it, that have a nerve fiber wrapped around it, and they set the muscle tone. And if that muscle is not firing right, that nodule is not firing right, it's set wrong, it tenses up that muscle. So what we try to do with the trigger point, where we squeeze it out.
So it's a portion of muscle that stay contracted.
Yeah, but like a fiber that makes the rest of the muscle be more tense. And so if we squeeze it all out, it's like you're squeezing a sponge, and it has to refill up with fresh blood, right? And that resets that. That's why stretching is also helpful, because you're stretching. Or another thing that I found helpful is you can put food wrap over it, like plastic, clear plastic, and with an ice cube you can dry it cold. Not the wet, not the feel of the cold, but with an ice cube you can massage these areas and it really works effectively. It's freaking cold, but you don't do it long. Yeah, I do it with ice cubes. You don't do it long, just do like half a minute or so. Just rub it out. Then it sort of freezes it. Janet Travell used to do fluoride, whatever, that spray that we can't buy anymore because of the ozone layer. And so dry ice is similar to that, because that would make the dry ice react on the skin. No, that's a good muscle. And yeah, I tell you, Janet Travell, that was a queen. She did really good work. And we all benefit from that a lot. Okay, so then what we do is we move down a little bit. So we have this super muscle man thing. We had the muscle here, that's the levator scapula, and now we got a muscle set down here that goes straight from the shoulder blade, the medial border, to the spine. So it goes from the origin is in the spine, because it pulls the shoulder blade again. So the origin is right here, spinous process of C7 and T5, and the medial border is where it inserts in. And what does it do? It brings the scapula closer. It adducts. It brings it closer to the midline. It adducts the scapula. And, of course, if it also contracts here, these fibers contract, it will bring that glenoid down. So it does that as well, a little bit. It's this one, when you have to do these exercises.
When the guys are lifting weights to build that muscle.
Not just the guys.
Okay.
Well, muscle lifting is very important. Building muscle is very important. You cannot avoid that. I mean, we have to, ultimately we got to be able to stand up. That's most important. Okay, then let's go back to the trapezius. We already talked about the trapezius. We talked about the attachments. External occipital protuberance, which is back here by the head, this bump here. And then it goes down the spine of the neck, which has an extension going back. That's known as the ligamentum nuchae. That's that term. And then we go back to spinous process all the way down where the ribs stop, which is T12. When we look at where the muscle anchors in on the side, it goes through the scapula. It's the outside thirds, they say, of the spine of the scapula. and it wraps around and actually goes also, you can't really see that, but it goes into the front, down in here. So it wraps around a little bit. And then it anchors up. So that's where it attaches. So when we look at the motion on the shoulder now, it stabilizes and raises and retracts the scapula. So it's similar to that levator scapula kind of thing. And it also rotates the glenoid cavity upward. This one, because it pulls more here, so it brings it upward. Even if it pulls here, it still brings it upward. And it also extends and tilts, rotates the head. We talked about that on Wednesday, a moment. So this talks a lot of motions, but if you think about muscles, the deeper muscles, like the levator scapula or the rhomboids, they are more localized working. They're stabilizing. They're doing one jointer things. The superficial muscle that's on top is bigger, and it moves the body more around as a motion versus a holding thing. So that's a general rule. It's not, you know. And then here are the trigger points. This is classic. This trigger point pattern, classic. People headache on the side, temple headache.
Is it right
Classic,
here?
right? Yeah, right. It goes right here like a horn. It goes right here. I just had that, and I asked, so anything here? A coat that doesn't fit right, that's heavy,
A purse.
a purse, yeah. Yeah, where's your backpack?
Mm-hmm.
If you have that pattern, you got to think about that. Oh, maybe I got to change the backpack thing. Because the first thing when you get a pain is like, doc, it hurts when I do that. Yeah, how about not doing that? Oh. I mean, I had a 94-year-old lady, and she was the best patient. I saw her one time. She fell, a chair collapsed the year before, so she broke some bone, 94. And then she came in, somebody brought her in, and she says, Doc, ever since I put that pillow away from the couch, when I sit down, it hurts my back. I said, I think you gotta sell the couch. She said, I can't do that. I said, well, how about put the pillow back? Oh.
Oh.
I said, you just gave me money and you told me I should pay you back. You solved your own problem. It was, well, and I'm glad because, 94, adjusting bones, you got to be a little careful what you do. Okay, that's the trapezius.